Good afternoon.
Good afternoon.
Thank you for joining the Senate Finance Committee. Today is Tuesday, January 27th, and we are now going to begin 7 bill hearings. We just finished 3 briefings, and we're going to begin with Senate Bill 244, and we have Jody Chilson from DLS. Jody, would you come to the table? Senate Bill 244 is Code Revision Health Maryland Medical Assistance Program. And after Jody presents, we have 1 witness virtually. Thank you.
Good afternoon, members of the committee. My name is Jody Chilson. I'm Assistant Manager of the Legislative Function, and I'm responsible for assigning and reviewing all the health legislation. Senate Bill 244 is a non-substantive code revision bill that makes Section 14103 of the Health General Article more user-friendly. Section 15103 is one of the main sections in the code that governs the Maryland Medical Assistance Program. Over time, it has become quite long and unwieldy. It covers a range of topics from the services required to be provided by Medicaid to the Maryland Medicaid Advisory Committee to managed care organizations. The bill makes the section more user-friendly by moving provisions governing the advisory committee and managed care organizations to their own sections, splitting up provisions that govern both Medicaid and the Maryland Children's Health Program so that those governing MCHIP are reflected in the subtitle governing that program, and making other non-substantive, stylistic, and clarifying changes. Drafters' notes are included in the bill to explain various changes that are being made. I ask for a favorable recommendation for the non-substantive code revision bill, and I'm happy to take any questions.
Well, thank you for that brief presentation.
Welcome.
I don't see any questions.
Okay.
Thank you very much.
Thank you very much.
So we now have 1 virtual witness, Laura Bogley.
But it's only showing her camera, not her audio.
Okay. Let's give her a minute. Can she sign off and back on, Tammy?
I think she tried.
Okay.
But
Looks like she's
She's-
frozen.
yeah.
Oh, there she is. She's fine.
Ms. Bogley, can you unmute? Ms. Bogley, we're ready when you are. You can start your testimony.
thank you, Madam Chair, members of the committee. I'm Laura Bogley, Executive Director of Maryland Right to Life. On behalf of the Board of Directors, I ask you to put patient health and safety before profits by giving this bill an unfavorable report. With the proliferation of abortion drugs, which now account for 3/4 of abortions in the U.S., the state of Maryland has learned that chemical abortion is safe. This bill would force taxpayers to reimburse pharmacists for the Maryland Medical Assistance Program for providing these lethal abortion women and others without a doctor's examination their patient safeguards. This bill also is a precursor for pharmacists to prescribe these drugs. The profit-minded abortion industry claims the chemical is safe and easy. The truth is that chemical abortion Madam Chair.
We try turning off your video and maybe your audio will be better. I think your signal might be low.
Madam Chair,
Yeah.
with your permission, can I, if
She's really breaking up.
I'm sorry, Madam Chair,
Yes.
if I turn off my video, may I have your permission to just use my audio?
Yes, let's try that. Thank you.
I don't know how much of that testimony you heard. Should I start from the beginning?
No, you can go from about, you were about 5 sentences in when we lost you.
Okay, let me try this again. Hope my connection stays stable. There's too many people using it today. So what we were asking is, with the proliferation of abortion drugs, which now account for nearly 3/4 of abortions in the U.S., the state of Maryland has a duty to ensure that chemical abortion is safe. This bill would force taxpayers to reimburse pharmacists through the Maryland Medical Assistance Program for providing these lethal abortion drugs to women and others without a doctor's examination or other patient safeguards. This bill also is a precursor for reimbursing pharmacists to prescribe these drugs directly. The profit-minded abortion industry claims that chemical abortion is safe and easy, but the truth is that chemical abortions are 4 times more dangerous than surgical abortions. New reports prove that at least 11% of women experience serious complications from abortion drugs. With the remote distribution of chemical abortion drugs, the demand on emergency room personnel to deal with abortion complications has increased 500%, increasing medical scarcity and threatening the conscious rights of medical providers. By reimbursing pharmacists to distribute abortion drugs or even to prescribe these drugs without oversight by a physician, the state will be putting women's lives at risk. For example, underestimation of gestational stage may result in higher likelihood of failed abortion, which becomes a medical emergency. Undetected ectopic pregnancies may rupture, leading to life-threatening hemorrhages. There also is risk of abortion coercion and forced ingestion. There are incidents from across the country where men have ordered abortion drugs and ordered them to women and administered them to women without their consent, causing unwanted abortions and traumatizing these mothers. Catastrophic complications can occur through teleabortion and even school telehealth, and emergency care may not be readily available in remote or underserved areas. Finally, I want to take this opportunity to remind the committee that although women have a right to legal abortion, the state has no obligation to fund abortions. Maryland is one of only 4 states that forces taxpayers to fund elective abortions. Last year, state taxpayers paid nearly $40 million to the abortion industry, including for more than 13,000 elective abortions. We must put patients before politics, and for these reasons, we urge your amendment to exclude abortion drugs or your unfavorable report. Thank you.
Thank you, Ms. Bogley. I don't see any questions, so that ends the hearing for Senate Bill 244. Next, we have 3 bills presented by Senator Simon Ayer. Senate Bill 96 is the first bill. It's the Sheila E. Hickson Behavioral Health Services Matching Grant Program for service members and veterans. Senator?
Thank you, Madam Chair. Committee, it's nice to see you all. I've worked hard to keep the written testimony in there and not very many at the table, respecting your time. So, Senate Bill 96, I've worked with the Department of Veterans and Military Families, the Department of Health, military advocates, and others on this consensus legislation, and I appreciate their support letters. As you know, in current law, there is a Sheila Hickson Behavioral Health Services Program for service members and veterans, which deals with common military behavior health issues, including PTSD, TBI, depression, anxiety, suicide, and others. These can be stemmed from combat exposure, military sexual assault, stress, and other difficulties transitioning into civilian life. The program is only eligible for service members who are currently serving on active duty. This bill simply expands those services to all service members, independent of active duty status. Last year, when I worked on the modernization of Maryland Military Laws Act, this issue came up with the Department of Health, and they asked me to put that in last year's bill, but due to the scope of the bill last year, the package, we decided not to change underlying policies. So therefore, I told them I'd do it this year. One of the advantages of passing last year's bill is the ease of changing the scope of benefits anywhere in Maryland law due to the centralization of military terms now in state government article. Therefore, while the scope of this change will be very impactful, the change is very simple. This bill changes the term active service member to service member, which is defined centrally in the state government article. That's the bill, and I ask for your favorable consideration.
Thank you, Senator. And we're going to hear testimony now from David from the Maryland Military Coalition. David.
That's tragic, says Senator. That's no problem. And members of this committee, thank you for the opportunity to testify in favor of Senator Simon Ayer's bill. I'm Dave Dragics, a retired Army Colonel and Legislative Director for the Maryland Military Coalition. This bill is a continuation of the process Senator Simon Ayer began in the last session in centralizing and modernizing Maryland's code with respect to terms related to the uniformed services. In this particular instance, the term service member. This bill corrects and aligns outdated military terminology in Maryland's code with current federal definitions, thereby improving the code's clarity. Clear and uniform definitions help ensure that laws such as this one are interpreted correctly in the future, and that programs like the Sheila E. Hickson Behavioral Health Services Matching Grant Program for service members and veterans continue to serve their intended populations without unintended consequences. So for these reasons, the Maryland Military Coalition strongly supports SB 0096 and asks for a favorable report from the committee. And we would like to thank Senator Simon Ayer for sponsoring this important legislation and appreciate his leadership on this issue.
Thank you for your testimony. Do I have any questions for the sponsor or for David Dragics? I see no questions. That ends the hearing on Senate Bill 96. Senator, your next bill is Senate Bill 123, Oversight Committee on Quality Care in Nursing Homes and Assisted Living Facilities membership.
Thank you, Madam Chair. As drafted, this consensus bill revises the number of senators and delegates on the Oversight Committee on Quality of Care in Nursing Homes and Assisted Living Facilities, which I'll just call the Oversight Committee. I've coordinated with both House and Senate committees, the Department of Aging, and the Oversight Committee. Currently, there are 2 senators and 2 delegates are assigned to this committee. This bill makes it 1 senator and 1 delegate. The reason is because prior to 2023, the Oversight Committee had shared responsibility between EEE and Finance. The 2 senators were assigned to the committee, and the House matched that number of senators by placing 2 members, 2 delegates. In 2023, as you all know, the Senate committee names were changed along with their scope of responsibility. As a result, the Oversight Committee no longer has 2 Senate committees, just the Finance Committee. Therefore, the Senate now only needs 1 member on the Oversight Committee. And since there's only 1 Senate member needed, the House no longer desires to have 2 members, but only 1. This bill simply updates the oversight membership as described. There is 1 amendment that I support that was proposed by the Department of Aging that repealed 2 member organizations that no longer exist, updates the proper name of the Maryland Association of Medical Adult Day Centers Services, and adds a representative from the Leading Age Maryland. The last thing it does is modifies the language to make it feasible to get all the members on the committee. And with that, I will ask for your favorable consideration.
Thank you, Senator. And we have Aaron Greenfield virtually from representing Leading Age.
Yeah, good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. Aaron Greenfield here on behalf of Leading Age Maryland. As Senator Simon Ayer mentioned, we are here favorable with an amendment to add Leading Age Maryland to the Oversight Committee on Quality of Care in Nursing Homes and Assisted Living Facilities. You have our written testimony, which does describe Leading Age Maryland. I think we can provide important value to this very important Oversight Committee in which Senator Simon Ayer is seeking to modernize the committee. And with that, I respectfully request a favorable report with the amendment adding Leading Age Maryland to the Oversight Committee. Thank you.
Thank you, Aaron. Do I have any questions for the sponsor or for our witness? Seeing no questions, thank you very much. That ends the hearing on Senate Bill 123. Senator Simon Ayer, your last bill, Senate Bill 37, Maryland Service Animal Programs Participant Disqualification Revisions.
Thank you. And again, trying to make this quick for you all, but understandable. Also, I worked with the Department of Veterans and Military Families on this bill, along with the Department of Disabilities, the Maryland Development Disability Council, the ARC of Maryland, others on this consensus legislation, and I've asked them to provide written testimony. This bill does 2 things. First, it simply makes consistent language between 2 similar programs that were created at different times, the Veteran Service Animal Program and the School Service Animal Program. And secondly, it updates the language in the programs to the standards of the Federal Americans with Disabilities Act. Words matter, and we don't want people to become ineligible for disability services simply because of outdated words. This program aligns the older program with the more recent program's language. There's no fiscal impact, no opposition. We have one amendment that aligns the service animal program in the Department of Disabilities that we passed last year. When this Senate Bill 37 was drafted, we didn't know if we were going to override that bill or not, and since it's been overridden, we're including that as an amendment.
Thank you, Senator. I don't see any witnesses on Senate Bill 37. Do I have any questions for the senator? No questions. Thank you. That ends the hearing for Senate Bill 37. Thank you for visiting, Senator Simon here. Next, we have Senate Bill 119, State Board of Environmental Health Specialist Sunset Extension, and we have Lee Broderick, I think. She's not, she's virtual, okay. And Megan Lynch will also testify. Is just going to be Megan then? It looks like it. Okay. Megan, do you want to go ahead?
Good afternoon, Chair Bidel, Vice Chair Hayes, committee members. For the record, Megan Lynch, Director of Governmental Affairs here at the Maryland Department of Health. I'll provide a very high-level overview, and then I'd be happy to turn it over to the board's executive director. Senate Bill 119 is a departmental bill. It extends the record. Megan Lynch, governmental. Hang tight here. There's a bit of a feedback. Can you hear me?
We can hear you, Megan.
Perfect. Senate Bill 119 is our departmental bill. It extends the termination date of the State Board of Environmental Health Specialists for 5 additional years through July 1st, 2032. And we would respectfully request your favorable vote on Senate Bill 119. Thank you so much.
Thank you. Is this Lee? Lee, would you like to give your testimony?
Can you hear me?
We can hear you.
Okay, thank you, Madam Chair. My name is Lee Broderick, and I serve as the Executive Director of the State Board of Environmental Health Specialists. Our board licenses environmental health specialists in Maryland, many of whom work in public health departments, but others are also employed by private industry, all with the mission of protecting public health by controlling environmental hazards. These are the professionals that make sure that the food you eat out at restaurants and buying stores is safe. They also inspect public swimming pools, spas, and bathing beaches. They investigate possible rabies exposures and help to make rabies vaccinations accessible to the public. Individual wells and private septic on-site sewage disposal systems are permitted by environmental health specialists to ensure the protection of vital groundwater resources. To be licensed to do this essential work, they must meet specific education and experience requirements, and so board staff review transcripts and track training to determine eligibility for licensure and license renewal. In addition to issuing and renewing licenses, the board staff is responsible for other day-to-day activities of the board and coordination of administrative activities with other government agencies. We're able to accomplish our mission economically by sharing support staff such as finance and IT with other health occupation boards under the Maryland Department of Health. The board itself has 9 members appointed by the governor with the advice of the secretary and advice and consent of the Senate. The membership includes 7 licensed environmental health specialists and 2 consumer representatives. The board sets standards for the profession, adopting and revising regulations to keep them in sync with current realities. There's a code of ethics for the practice defined by statute and regulation, which the board also enforces. I worked for 31 years as an environmental health specialist myself, and I'm proud to be associated with a profession that preemptively strives to keep our citizens healthy and safe. The board supports SB 119 and requests a favorable report to extend the board's sunset to July 1st, 2032. Thank you for this opportunity to testify.
Thank you very much. I do have a question from Senator Hershey.
Thank you, Madam Chair. Megan, that was there. Megan, just a quick question. The fiscal note talks about that this board is subject to an evaluation by the Office of Program Evaluation and Government Accountability within DLS. Are you aware if they have ever requested an evaluation or if they had performed an evaluation on this board?
Senator, let me take that back to the team and just follow up. Off the top of my head, I'm not aware of that, but
Okay.
I'll follow up.
it mentions that it might not have been asked, but I just want to see if that was done or if that has not been completed yet or not.
Absolutely.
Thank you.
Yep.
Thank you so much. Thank you, Madam Chair.
Thank you.
I don't see any other questions. Thank you very much for your testimony. And that ends the hearing on Senate Bill 119. Next, we'll have Senate Bill 19 with Senator Ellis, Maryland Commission on Women's Health Advancement. He's going to have Edith Perry. Is she part of your panel?
Yes, Madam Chair, but I believe because of snow, she is not going to be here.
Okay,
Not
that's
sure.
fine. And then we'll have 2 virtual. So thank you, Senator.
So good afternoon, Chair Bottle, Vice Chair Hayes, and members of the Senate Finance Committee. I am Senator Arthur Ellis, representing Charles County, District 28. I'm here to present Senate Bill 19, Maryland Commission on Women's Health Advancement. This bill is intended to create a commission to study the formation of a Maryland hospital for women. This bill strengthens Maryland's health infrastructure by establishing a commission to evaluate the feasibility of a women's hospital in Southern Maryland region and to develop a statewide clinical network dedicated to improving health outcomes across women's lifespan. Why would I ask for this facility to be located in Southern Maryland, the fastest growing region in the state, including Prince George's, Anne Arundel County, Charles County, St. Mary's, and Calvert County? I heard statistics saying that 70% of women have to leave this area to birth their children, around 70%, because the facilities are wholly inadequate. And we need to look at that particular issue, which this bill that creates the commission will provide. Through rigorous data analysis and stakeholder input, the commission will develop strategic recommendations aimed at ensuring equitable access to high-quality care for all women. So why is Senate Bill 19 necessary? It's necessary because women across the state of Maryland continue to experience persistent and unacceptable disparities in access to care, quality of services, and health outcomes. Based on the 2024 report from the United Health Foundation, Maryland's severe maternity morbidity rate is 91 per 10,000 delivery. That's 91 per 10,000 deliveries, which is higher than the national rate of 88.3. So Maryland is still above that level. I know over the past 7 years, this body has heard quite a few of these maternal health bills, starting with the doula bills, Maryland Maternal Health Act, which was a priority of the Black Caucus, safe sleep bills. We looked at bills requiring blood pressure cups. All those were passed. I'm happy to say that Maryland has moved from a score of F to now we are a C+. Yes, maternal health is graded. There are organizations out there who grade maternal health throughout the nation. And Maryland is now in the top 10 states for maternal health. But we still have a ways to go to be, I ask the question, why can't we be number 1 in the nation for maternal health? And I think, in women's health, I think it's possible for us to get there. Additionally, Maryland's infant mortality rate is 5.9 deaths per 1,000 live births. That's 5.9 per 1,000, which still exceeds the national average of 5.5. And that's from the March of Dimes 2025 statistics. Furthermore, the Maryland Department of Health continues to document disparities across heart disease, diabetes, stroke, and obesity, with women of color disproportionately impacted by these adverse issues. I did a Google search to find out which other states have women's hospital. And we have Orlando, Florida, Advent Health for Women, and Med Health Women's in Anderson, South Carolina, Bellevue Women's Hospital, which is owned by a company called Ellis Medicine in upstate New York, no relation to this guy. We have Christiana Hospital in Christiana, Delaware, Deaconess Gateway Women's Hospital in Evanston, Indiana. And let me read this really quick, a summary of that hospital in Indiana. It says the Women's Hospital is devoted to providing world-class health care from our family to yours, one exceptional experience at a time, with dedicated and compassionate physicians and staff. The Women's Hospital provides a complete range of healthcare services to women and infants in a soothing, spa-like atmosphere. I was impressed with that outcome right there. We can go on to so many other states that have women's hospital, from Detroit, Michigan, Hawaii, Omaha, Nebraska, Boston, Massachusetts. I think they have 3 there. Lakeside Women's Hospital in Oklahoma City, Chicago, New York City have probably 3 women's hospital. The Women's Hospital of Texas, University of Missouri Women's and Children's Hospital, University of Pittsburgh Medical Center, McGee Women's Hospital in Pittsburgh, Winnie Palmer Hospital for Women and Babies in Orlando, Philadelphia, Rhode Island, and I searched Maryland. I typed it intentionally, Women's Hospital in Maryland, and this came up. Let's see, Medicine, Maryland, 1752 to 1920. There's this women's hospital in Baltimore. It was located on Lafayette and John Street, like 1882 to like 1884. And that's it for Maryland. I mean, we are treating our women and children as a thing of the past. We are not dedicating the resources like we can, like so many others throughout the nation are. And I believe it's about time we, as a government, make a statement that is unacceptable. And I really want to also thank DLS for going through the fiscal note. They basically said that the agencies who wrote the fiscal note overestimated the true cost of staffing this commission. And we spoke about that in other parts, yeah. And so that is in the fiscal notes. I really want to thank DLS for pointing that out. This is something we can do, you know, and I'm so upset that, to be honest, that one of the agencies came in unfavorable. And I met with that director, and instead of working with us to solve this problem, he wants to perpetuate these disparities. I mean, just don't come out against stuff. That is the problem. That is the past. We're working to solve these problems. And as a state, I think we can do that. And I just want to close out with I wrote an amendment to add the one representative for this commission to come from the Southern Maryland chapter of the National Coalition of 100 Black Women. Very active group. They reached out to me and said, hey, can we be on that? So we're getting a lot of that. And we initially said, well, no, let the governor decide. But they were so excited about this. We just said, why not? Yes. And so, Madam Chair and members of the committee, I hope to have a favorable report on Senate Bill 19.
Thank you, Senator. I don't see any questions for you immediately. Our one person virtually is Laura Bogley. Our other virtual was not able to get on. So, Ms. Bogley, would you like to testify? Maybe.
Thank you again, Madam Chair, and hopefully you can hear me this time. I'm Laura
We can
Bogley,
hear.
Executive Director of Maryland Rights Life. On behalf of the Board of Directors, we applaud Senator Ellis's effort to improve women's health in Maryland, and we support this bill with an important amendment. Our proposed amendment would prioritize public funding for maternal and fetal health services, which have the objective of saving the lives of both mothers and babies. I think this is how we move ahead into the future. The fact that 85% of OBGYNs refuse to commit abortions is evidence that abortion is not an essential part of women's health care. Elective abortion is never medically necessary and could put future pregnancies at risk. Now, meanwhile, all hospitals in the state of Maryland do provide medical intervention when it's medically indicated to save the life of the mother, and women don't need to fear that they're going to be denied that life-saving intervention. But by prioritizing abortion funding over legitimate health care, the state has failed to meet the needs of pregnant women and families. In fact, recent data highlights, as Senator Ellis said, Maryland's low maternal and fetal health ratings and significant challenges, especially in birth incomes and racial equity. Maryland's high abortion rate and its maternal morbidity and preterm birth rates are often driven by the same underlying social determinants of health. Black women in Maryland have the highest rates of both induced abortion and severe maternal morbidity and preterm births. Repeated surgical abortions are associated with a higher risk of preterm birth due to potential cervical and uterine scarring. This is known in medical practice as Asherman syndrome, and we must improve these outcomes for women. Although also problematic is the fact that Maryland is one of only 3 states that refuses to report abortion data to the CDC. And without this information, the state's unable to accurately assess how public investments in the abortion industry are impacting women's reproductive health or even reducing the number of unplanned pregnancies. So for these reasons, we urge your amendment to preserve the integrity of this bill and to give women access to life-saving alternatives to abortion. Thank you.
Thank you, Ms. Bugley. Do I have any questions from the panel? I do. Senator Lamb.
Yeah, just one brief question. Thank you, Senator, for bringing this up. Obviously, a lot packaged in here. The only thing I wanted to kind of highlight is that I know a couple years ago I had a bill to try to address primary care spending, trying to increase access to primary care in the state. And I think in the end, instead of setting up a separate commission, there was a work group that was set up within the Maryland Healthcare Commission to be able to look at that. And it's still going on for, this is now 3 years, I think, after that was put together. And so just wanted to kind of uplift that just for your attention. If there's some reason to not pass this, like want to leave that as an avenue that you should probably look at too, that there's some ability to maybe fit this under the Maryland Healthcare Commission as a standing work group that can kind of continue on for a few years. Because I know the charge here was for like 7 years, I think it was. So, just wanted to at least, put that on your radar, depending on how things go.
Yeah, thank you, Senator. And so, basically, coming up with the bill, spoke to a lot of stakeholders, visited several hospitals in the Southern Maryland region, inside Prince George's County, Charles County, their maternal area, maternal departments, labor and delivery departments, and really put this bill together. As you know, any legislation is about really making it better. And if we can find a place for this to be that already exists, that'd be really great. And I just want to also mention, finally, that I look forward to basically hearing your ideas and where we can place this commission if it's not standalone. I'd definitely be welcome. But as a state, we need to be working on this. And could I just mention one thing? We're focused a lot on maternal and infant health, but this bill is a complete health care for women from the birthing years through the later years. And let me read really quick, Madam Chair, just 30 more seconds, from Lakeside Women's Hospital in Oklahoma City, Oklahoma, where I was stationed my early careers in the military. Their mission says, quote, from routine well women visits to pregnancy and childbirth, gynecological surgery, or menopause care, we focus on health and well-being of every woman. So this is a very comprehensive from birth and years through later years in life. So thank you, Madam Chair, for being able to share this.
Thank you, Senator. Thank you for a lot of the work that you've done for women's health. You really have been an amazing champion for us, so thank you.
Thank you,
Any other questions? All right, well, that ends the hearing for Senate Bill 19.
Next bill, we'll hear from our chair, Senator Bidle, on Senate Bill 246, Health Services Cost Review Commission, term of office of members.
So thank you, committee. I'm the last bill of the day, so I'll try to make this brief. But Senate Bill 246 addresses the appointments to the Health Services Cost Review Commission, which is a very important commission as it sets our hospital rates in Maryland. And as you all have followed the AHEAD model, you know that they've done a lot of work on this interim. But last year we had an appointment that came up to the Executive Noms Committee, and we chose not to vote for that appointment. The governor never replaced that person during the interim, and so he served a whole additional year. So it was something that Executive Noms didn't choose, but he got to serve a whole nother year. So what this bill says is if Executive Noms does not approve an appointment, that the governor needs to find a replacement within not to exceed 6 months. And it's that simple. And that is Senate Bill 246. Thank you.
Questions, Senator Lamb.
Yeah, thank you, Vice Chair. So thanks for introducing the bill. I'm just looking at the bill folder. There's only one, testimony in here. It's from Megan Renfrew, who I guess is the Deputy Director of the HSCRC, although she doesn't make clear in here whether she's providing this testimony on behalf of the commission or on, behalf of herself. But, I guess one of the points she brings up here is, I guess that 3 out of the 7 seats of the HSCRC are allowed, up to that amount, are allowed to be designated to hospital representatives. And she references the fact here that that may be kind of a lot. I don't know if you have any, sense or feedback on that. Just wanted to kind of get what your thoughts were.
So, Senator, 3 out of 7, they're the minority. So those 3 hospital representatives could not really change, there wouldn't be enough of a majority to change anything. I think it's important that since they're setting hospital rates, that we have people that understand the finances of a hospital. The other 4 cannot be affiliated with a hospital. So, that I think separates that. But this person was a hospital, president, and from what I've heard, we will, in Executive Noms, hear his replacement this year, who is another hospital president. So the problem isn't what the position represented. The problem is that we chose not to approve that person, and a year later, he's still serving.
Right. I mean, I guess the point that Ms. Renfrew was making in here is that, if you have 3 members from representing hospitals, and then if there's, of the other 4 remaining members, if one can't make it because of a family emergency, some other reason, the 3 members could decide to not attend the meeting, leaving the commission without a quorum to be able to actually do business. So I think that was, I'm not sure
Isn't that true now? I mean, right now it's 4 and 3.
That is true
We're
now.
not changing that
I guess
ratio.
her point is that, if we're opening up and I'm not sure I fully agree with the point. I'm just, trying to get your sense of the response to that, right? Yeah. That if we're opening up the membership to kind of reconsideration, I guess she was putting that out there. And again, I'm not sure if she's speaking on behalf of herself or on behalf of the commission. I guess the last point here is, so a couple years ago, there was a bill that I had sponsored to require them to come through executive nominations. So there are actually there are a few commissioners that are on the HSCRC that have not come through executive noms for confirmation at any point. And so, her other point here is, in support of kind of a 6-month holdover for folks, any thoughts on that? Because I guess the thought here is that, particularly for the ones that haven't been confirmed, maybe 6 months is sufficient just to, get them through. And then if they want to be re-upped and the governor's office wants to re-up them, then at least they come back through. But just wanted to kind of get your sense on that.
Actually, I wanted the bill to say at the end of our session, if they had, a new person hadn't been appointed, that that person was finished serving, but council wisely talked me out of that and had me do the 6-month, to allow the 6-month extension until a new appointment's made.
Okay.
I actually was considering something that would change all of the appointments, that if they're not completed by the end of the term, the governor has to appoint someone else, but I was discouraged from that.
Yeah, I mean, personally, I don't disagree with you. I think there are a lot of hanger-oners that, hang on for a while. So, I get that.
Okay.
yeah.
I appreciate your questions. Thank you.
Thank you.
Are there any additional questions? Seeing none, thank you so much, Madam
you.
Chair. And that ends the bill hearings for this evening. We'll take a break.